Hello, everyone. I am Joan Dublin, President and CEO for Metropolitan Family Health Network. It is my honor to welcome you to our annual celebration of Community Health Center Week. Metropolitan is a federally qualified health center that provides patient medical services for more than 17,000 women, men, and children in Hudson County. We offer services that include care for adults, children, OBGYN, dental, podiatry, integrated behavioral health, and telemedical services. On our premises, we also have laboratory and a 340B pharmacy. COVID-19 has changed the way Metropolitan Health operates, but it has not altered our dedication to our community and to our mission of making high-quality, affordable healthcare accessible. In fact, the pandemic has made us more committed to providing the services and programs our community well deserves. COVID-19 is also not preventing us from being with you to celebrate National Health Center Week, albeit virtually. Our theme for this year's celebration is keeping it moving, as we intend to continue serving our community no matter what. Social distancing is a must. We have many special guests who have prepared for you, messages for you. They are individuals who have been supportive of our community and Metropolitan. At this time, I will pause and we will run a video with segments from medical officials and others.
Hi, I'm Senator Bob Menendez, your senior United States Senator, and a proud, longtime advocate for our state's community health centers. I'd like to send my greeting today to the Metropolitan Family Health Network team as you all gather to celebrate National Health Center Week, and to thank you for all the hard work you do all year round. This year has brought immense challenges to our healthcare system, and the going has not been easy. But as always, New Jersey's community health centers rose to the challenge. Every single day, all of you at Metropolitan Health step up to the plate to serve those most in need of access to healthcare. I know that when I am advocating in Washington for funding and support for community health centers like Metropolitan Health, I'm also advocating for a father to get life-saving care for his diabetes, for a mother to be able to get prenatal care, or for a child to get treatment for their asthma. Supporting community health centers is synonymous with caring for the most vulnerable in our communities, and this is true now more than ever. We must continue to work together to ensure everyone in our communities is empowered to live a healthy life so they can live their lives to the fullest. That's what Metropolitan Family Health does every day. With over 50,000 patient visits a year, the work you do is just simply incredible. For that and for your continued dedication to serving this community, I thank you and I send warm wishes during National Health Center Week.
Hey everyone, it's Cory Booker, and I'm happy to wish everyone a National Community Health Center Week. From my time working as a mayor, I deeply understood the vital support that our community health centers do to the well-being of an entire community. And I am just excited that you all continue to demonstrate how truly vital you are, the kind of impact you make, and especially during this time of a global pandemic, you all are on the front lines of doing heroic work. So here is to the heroes, to those providers, to the nurses, to the staff, and of course even to the patients, to everyone involved in our community health centers. I am grateful for you. And I'm also honored to be able to work for you down here in Washington to continue to fight for those kind of funding streams. It makes your work stronger. we have a lot more work to do because I think we as a country should expand the resources and the support we give to these vital elements of our community. I am excited by the work that you do, and more importantly, by the values and the virtues that you help our overall society really affirm. Healthcare is a human right, and you all are fighting for those rights every single day. Thank you, and may you continue the work. May it expand, may it enrich, may it elevate us all.
Hello, I'm Donald M. Payne Jr., proud Congressman for New Jersey's 10th District. This week is National Health Center Week. It is a time for us to recognize and celebrate the thousands of brave men and women who work at Metropolitan Family Health Network. They've been on the front lines in our battle against the coronavirus to protect you and your loved ones, and they deserve our thanks and praise. This is nothing new for them. They were helping us get affordable, quality health care before the public health crisis, and they will be there to provide it after this crisis is over. They do it because they care about you and your health. Now it's our turn to protect them and limit the spread of coronavirus. Wash your hands with soap and water regularly. Avoid groups of more than 10 people. Practice social distancing when you shop for necessities, and make sure you wear a mask, especially when you're indoors. When we follow these simple steps, we can make it safe for everyone until we can find a cure for this dreaded disease. We can and will defeat the coronavirus one day, and we will reopen society completely and safely. But until then, we must do our part to help ourselves and each other stay safe. We're all in this together, and we must work together to beat this global pandemic. So thank you to the first responders and medical professionals at the Metropolitan Family Health Network during National Health Center Week. They are the true heroes for all they do to keep us healthy and secure. Thank you very much and have a great day.
The Metropolitan Family Health Network for putting on this virtual event celebrating National Health Center Week. National Health Center Week is a time for us to commemorate and appreciate all the important work health centers do here in New Jersey and across the country. In the 8th District, health centers are an essential aspect of care for thousands of people. Health centers help to expand access to quality care and provide a plethora of services for our community, such as primary care, behavioral health, disease management, preventive care, family planning, and so much more. The work and services offered by these health centers help countless Americans obtain the quality care they deserve. During this COVID-19 pandemic, health centers have been crucial to providing testing and many other important services to those in need. New Jersey was among the hardest hit states in the country, and our health centers were integral in caring for people during that difficult time and in helping to stop the spread of this virus. I have always fought for health centers here in Congress. The work these centers do is essential to my community, and I greatly appreciate their effort to better the lives of those living in New Jersey's 8th District. Thank you for all of the dedication towards improving the lives of others. Keep up the hard work.
Hello, I'm Congresswoman Bonnie Watson Coleman, coming to you from my home in Ewing, and I am delighted to join you in celebrating National Health Center Week. If the crisis we're currently experiencing has taught us anything, It should be the importance of accessible, high quality, affordable health care for every single family here in New Jersey and well beyond. That's what our health centers have always done, and what they continue to do in the midst of the coronavirus pandemic. The fact that you've refused to back down from your mission amid all of the challenges the pandemic has presented speaks to your understanding of the role you play in our communities. I am tremendously grateful for all that you do. One of the core things I fight for every day is the right of every person in this country to health care. Without it, you can't be expected to show up and pay attention in school. You can't go into work. You can't do much to better yourself or work toward the American dream. And we've learned that without it, you are always at risk, whether it's an illness that could have been easily treated early or prevented altogether, or it's a comorbidity that makes something like COVID-19 extremely dangerous. Health centers play a critical role in making sure everyone gets regular care. I will continue to work at the federal level to support the work that you do. Thank you for being there for our communities.
Hey everybody, Governor Phil Murphy here. Although I wish we could be together in person, I'm thrilled to have a virtual opportunity to celebrate National Health Center Week with the Metropolitan Family Health Network. Over the past few months, the healthcare community has shown the world what it means to be called to service of others. Your bravery, dedication, and selflessness have saved countless lives, eased the suffering of thousands, and inspired every single one of us. It is often only on our worst days, when we are anxious about our own health or the health of a loved one, that we realize how much we depend on the work of the healthcare community. There is no way we will ever be able to express the depth of our gratitude for all you have done to keep New Jerseyans healthy during the COVID-19 pandemic. And as we watch anxiously what is happening in other states, we know you have gone above and beyond to help us reach to where we are today. I want you to know that you do not just have our gratitude, you have our commitment that our fight against COVID-19 is a partnership. We value all you have done to keep us safe and will continue to do all we can in return. Together, we will continue to move forward through this incredible challenge. I look forward to celebrating with all of you in person next year, and thanks to all of you, we will have a great deal to celebrate. Until then, thank you, keep up the incredible work, and God bless you all.
Hi everyone, this is First Lady Tammy Murphy. It is my honor to celebrate National Health Center Week with the Metropolitan Family Health Network. Since the beginning of the COVID-19 pandemic, New Jerseyans all over the state have recognized how truly lucky we are to have selfless, courageous, dedicated health professionals protecting us during this difficult time. I want to express our immense gratitude for all you have done these past few months, as well as all you have done in our shared mission to fix New Jersey's maternal and infant health crisis. I have seen firsthand the care, dedication, and passion you have for the residents of Hudson County when I visited your Jersey City location last December, and when you participated in our Jersey City Family Festival last January by providing dental and medical screenings to our attendees. You have been a trusted ally for New Jersey's mothers and babies, especially in these challenging times. I know that together we will continue to move forward through this incredible challenge, not just to make it through the COVID-19 pandemic, but to improve the health of millions of mothers and babies until New Jersey is the safest and most equitable place in the nation to deliver a baby. Thank you for all you have done and all you continue to do. Keep up the great work, and God bless.
Hello, my name is Jim McGravy, and I just want to say thank you to Joan, to Metropolitan, and to the federally qualified healthcare centers, not only in Hudson County, but throughout the state. And particularly to Joan Dublin for her great leadership, her stewardship of Metropolitan, and working cooperatively with the New Jersey Reentry Corporation and the federally qualified healthcare centers all throughout northern and central New Jersey. 100 clients coming home from prison, from jail, from addiction treatment. The federally qualified healthcare centers provide the bedrock of opportunity in terms of quality healthcare. 40% of our clients have mental health illness, and accessing the FQHC is indispensable. For those that suffer from hepatitis C or HIV or diabetes, the FQHCs provide an opportunity to be healed. And right here in Hudson County, I can't express my gratitude enough to Joan and her entire team, Dr. Beatty and the team of physicians, the nurses, and the healthcare practitioners. Thank you for literally going through walls to make sure that persons coming home from prison and jail and addiction treatment have quality access. You know, the reality is, in the first 2 weeks of release, individuals coming out of prison are 129 times more likely to die of opioid overdose, to die. And due to the intervention of Joan and her team in Metropolitan, we've cut those statistics dramatically here in Hudson County and working with FQHCs all across the state. Frankly, presumptive eligibility, I'd like to thank Commissioner Carol Johnson, and I'd like to thank the directors of the federally qualified healthcare centers for, on good faith, recognizing that our clients are who we say they are and willing to treat them. So again, on this joyous occasion, I just want to say thank you for job well done, for recognizing day in and day out the hard work of delivering healthcare services to our men and women, for treating them with dignity, to providing access to quality healthcare, the same kind of healthcare that, God willing, every American ought to be entitled to be provided. So again, on behalf of the New Jersey Reentry Corporation, and most importantly, the men and women that we're privileged to serve, thank you, Godspeed, and we need you all that much more in the coming year. Thank you.
Hi, this is Glenn McFarland, the President and CEO from Aetna Better Health of New Jersey. This year, National Health Center Week looks very different. Although our celebration is a little quieter, our dedication and commitment to the health of our communities has not wavered. Over the past 5 decades, community health centers like Metropolitan Family Health Network have been providing high-quality, affordable health care to their patients. Health centers play an integral part in strengthening the fabric of communities across our state, which is highlighted now more than ever as we fight the ongoing pandemic. Aetna Better Health of New Jersey is committing to donate 400 bags of healthy food to Metropolitan Family Health Network to distribute to the community during National Health Center Week. While we celebrate throughout the week, it is important that we honor the lives lost and show our gratitude to those fighting to keep us healthy. Thank you to all the frontline staff and the whole Metropolitan Family Health Network team for keeping our communities and our members safe and healthy now and always. You are the true heroes. Happy Health Center Week from all of us at Aetna Better Health of New Jersey.
Thanks to the generosity of our vendors and our neighbors, today we are distributing food to our community residents. Special thanks to Aetna Better Health of New Jersey for their donation of more than 400 bags of healthy food. I would also like to thank the following: United Health, WellCare, Amerigroup, Dominic Coviello, Cairo Document Solutions of New York, Horizon New Jersey Health, Jones & Associates Communications, Crivet & Crivet, LabCorp, and Visor. Thanks to our elected officials and community partners for contributing to this virtual presentation. Thank you all. In closing, I want to acknowledge and thank our physicians, providers, and staff members who have continued to provide compassionate, quality care for our community throughout this pandemic. Please stay safe, wear your mask, wash your hands, and keep in touch. Thank you.